Hi, I'm going to review the clinical reasoning PowerPoint for you today. So, objectives are to define levels of thinking in clinical reasoning in nursing practice, describe the theories related to critical thinking, describe strategies for critical thinking, and apply critical analysis to patient care situations. Clinical reasoning, it's actually a process of thinking critically, involves thinking for ourselves by carefully examining the way we make sense of the world. Everybody walks, and I always like to say we all walk in our own dream, meaning that we see things in the privacy of our own mind, and we interpret the world in our own way based on our own experiences, knowledge, and our ability to perceive. A critical thinking process chooses best actions to meet a desired goal. Nurses make decisions utilizing critical thinking. Critical thinking is being involved actively in the learning process, positive internal mental focus and control. The interesting thing, we're performing this critical analysis and this high in-depth thinking the whole time we're going a million miles a minute. We're doing it on our feet. We're doing it on the run. We're learning to be and act like a nurse, to do our assessments, to function in a situation that has high stimulations. They talk about a football quarterback when he becomes the most effective is when the game slows down for him, meaning that he's able to see the nuances of the game and the game is slowed down enough for him that he's able to make decisions. In truth, what's happening is his thought processes and his decision making has gotten so practiced that he is able to make decisions very, very quickly. One of my favorite authors is Malcolm Gladwell, and he writes a book called Blink, where he describes our process of thinking without thinking. He opens the book by describing a police officer that's driving down the road, and he drives by this alley and he just knows something's wrong in that alley. Doesn't have anything tangible that tells him that there's something going on there, but he just knows, and it's all a result of his experience and his training and the thought that he's running through a checklist a million times a minute in his brain without consciously thinking about it. Another example that he gives in this book is this insurance company in England bought what they believed to be an ancient marble statue to put in their lobby, and it was a significant amount of money that they paid for it. So they wanted to make sure that it was authentic. They had experts coming in, and experts came in, looked at it, it fit the period, and it was everything was correct, but they just all had this uncanny feeling. Expert after expert came in, couldn't put their finger on it. Eventually, the insurance company did buy the statue, and then months later, when a form of carbon dating got more improved, they found indeed that it was a fake, but nobody could put their finger on what was wrong with the statue. Yet everybody the experts seemed to believe that it was a fake. Concepts to critical thinking, reasoning, and clinical judgment. Critical thinking it's a process that's self-directed, self-disciplined, self-monitored, and self-corrective. We all learn from our experience. We all see the world in our unique ways, and we all have to learn to interpret that in a way that makes the most sense to us. It's a cognitive process. It's deliberate. It's nonlinear. And that's a hard concept to explain, except for the fact that we tend to look at things in a very nonlinear process. We can arrange our assessments to go from head to toe. We can arrange them to do a focused assessment by looking at just the heart or a surgical site, but we're taking in things constantly with multiple stimuli and from multiple sources: our hearing, our sight, our sounds, what people are telling us. So we collect, we assess, we analyze, and we apply what we're seeing to our standards and theories of practice. We try and differentiate between what is important and what is extraneous, what's not necessary. We predict and we interpret. So I used to say that, with my experience in nursing care, by the time I could go in and meet a patient, be very, very quick at establishing rapport with the patient, I would always shake his hand. Of course, I don't know that we do that anymore now with COVID, but I could pretty much predict the way the process was going to go throughout the day and what the patient was going to be like. So then we learn to evaluate and see how right we were in the process and how well we were developed in our care. So critical thinkers solve problems by making logical judgments and drawing conclusions that are fact-based and belief-based, based on our experience. Sometimes it's wrong. Critical thinking reflects back to what we have already learned from Bloom's taxonomy, which really doesn't probably make a lot of sense to you guys because it's an educational term, but it's our the way we move, our attitudes and our values, and our cognitive memorization of facts. So excellent video on critical thinking that I'll let you view on your own. And then here's a statement about what is nursing. It's both an art and it's a science. One of the doctors that I worked with at Mercy Hospital, Dr. Sabe, used to talk about how we would titrate a drip. And he said, I couldn't tell you how to do it. And this was a man that took pride in everything that he did know and wasn't at any loss to always tell you that he knew something. But he said, you guys have this feeling, this ability to know how to decrease a drip and to manage it. So, if we were cutting back on a blood pressure medicine, to know that, or an anesthetic for somebody that was intubated and on a ventilator, we just developed that experiential knowledge to be able to adjust the dosages down and to adjust them back up as we saw things happening. Reasoning, it's the way we organize our feelings and our ideas. It's how we make sense of the world around us. So, think like a nurse is the nursing process, and that's the same as a scientific process. Where we work, we make a hypothesis, we test it, we act on it, and then we evaluate on what our actions, how effective we saw our actions were to be. So I'll leave you to review this on your own. And this talks about, our assessment and the different steps that we're involved with. Sorry, my face is hiding this. But how the different steps in the ADPI system, I'll let you look at that. So our judgments are based on our critical thinking and our reasoning, and it provides the basis and the reason for our actions, and the reason when we take action or we don't take action. So one of a common situation when you're a new nurse is that you work midnights, and as you work midnights, patient conditions change, and there's always a debate about, well, do I need to notify the doctor? You know, do I need to call the doctor? Do I need to wake him up in the middle of the night? So I always had a process that would, you know, chances are if I knew something I would need to notify, but the question in my mind became, do I need to do that now, or can it wait till last thing? Can I notify him at the end of a shift? So, for instance, if I have a lab test that comes back and it's still abnormal, but it's better than what it was, or even by notifying that person that he's not going to change anything at this point in time. So, but however, if we're headed in a worse direction, say like we had a potassium that was 5, we were concerned about that. They repeated the potassium because it's about this person was heading into renal failure, and now we had a potassium that was up to 5.7. It's time to notify him so that we can get some action to give some Kayexalate, which is a medicine that's used to absorb the potassium from the gut. Opposite situation too. We have somebody that's hypokalemic, low potassium, and we needed to, you know, we're giving him potassium supplementation, either IV or PO. Typical orders are that you give that potassium supplementation, and an hour after it's completed, you recheck the potassium. So we started out with a critical potassium of 3.1, and we repeat that potassium, and it's now 3.8. It's headed north. It's headed in a good orderly direction, and chances are he's not going to add any more potassium in the middle of the night, but maybe in the morning he might consider adding it so that he could probably be notified at rounds. So just some of the situations that you get into. Concept mapping. This is a way we can kind of identify ideas, and it gives us a visual presentation of the way things are. I tend to draw things if I'm trying to figure out a problem, or if I'm trying to, I do a little building on my own, and if I'm trying to organize a plan of how I'm going to do something, or all the things that I need to do, I will write out the things that I need to do. I won't necessarily order them, but then I'll put a timeline, and I'll put those concepts of what I need to do into the timeline. What needs to happen before I'm able to do this. So, and I can remember mentally going through that whole process while I was working and trying to decide what would be the best thing to, you know, the best way for me to get through the rest of my shift and accomplish all the things I needed to do. What things did I have were essential that I got them done, you know, from a safety point of view, from a physical health point of view on the patient, and what things I needed to get done so I could get the other things done. It helps us find new meetings, and it helps us to find different ways of looking at a problem. If you're a visual person, a lot of men are visual people. It helps us see interrelationships and get a good clear picture of what's going on. I found this particularly helpful when I went as a student, those many years ago, about looking at the GI system, because that to me just seemed like a big plumbing system. And I was able to see one effect here, what it caused behind the system, and what it could cause in front of the system. So it was helpful sometimes to draw it. So, okay. Thank you. See you in the next video.